Hello. The charter amendments proposed in a petition now circulating in Shaker Heights call for a number of initiatives, several of which the city has already implemented in some form. For example, the charter amendments call for the creation of an entirely new department of 35 licensed mental health clinicians, social workers, and medics who would replace police officers, with these new employees assuming a wide range of the police officers' duties, including addressing all calls involving persons with mental health issues. In fact, the city, with the input and the guidance of City Council and residents, has already established a mental health response program that has been very successful and is now being considered as a model in other communities in our area. Today I'm joined by Annette Amistadi, the social worker for the city's mental health response program. Thanks for joining me, Annette.
Thanks for having me, Mayor.
Tell us about the goals of the city's mental health response program.
Well, our primary goal is to improve outcomes for residents. I do this by linking people with appropriate care when I'm on scene and providing follow-up care. Another goal is to provide ongoing support and resources to help prevent future crisis situations. I also try to serve as a resource for our first responders by sharing options for treatment. And another important goal is providing assistance in de-escalating situations.
So you meet with residents in crisis along with our first responders?
Yes. When a resident calls 911 or the non-emergency number, I respond to appropriate calls simultaneously with, but separate from, the police and fire department. Once on site, we all work together, the resident, myself, and first responders, to create a plan for addressing the immediate crisis situation and then developing the next steps. I really appreciate that our first responders ensure the scene is safe so that I can assist residents. I never respond without them.
I'm glad you brought that up because it's a key distinction between our current mental health response program and the one proposed in this petition drive, where social workers would be responding to a great variety of calls without the police and could potentially be put in harm's way. Can you give me an idea of the number of people you're seeing and the sorts of needs that you're helping to address?
In the first quarter of 2023, 150 calls were referred to the program. For 67 of the referrals, I was on scene, and I completed 133 follow-ups, either over the phone or in person. I'm often responding to a person in crisis, which can include risk of suicide or mental health crisis, physical health concerns, memory issues, homelessness, or domestic violence situations, just to name a few.
With your professional background, Annette, and with the support of our first responders, I know we're well positioned to help our residents. Thank you for the good work that you're doing, Annette. Shaker residents and first responders are fortunate to have you on the team. And thank all of you for joining us today. Be well.